Welcome to NJBIA's Minding Your Business. I'm your host, Bob Considine. Well, ACI Medical and Dental School has a long-established reputation of being one of the top technical schools in New Jersey, providing hands-on training for the in-demand medical and dental industries. And now ACI is offering even more to its students with a brand new state-of-the-art campus in central New Jersey. We visited Frank Preston, president of ACI Medical and Dental School, to check out the new facility and the programs that are launching so many successful careers. Have a look. So Frank, before we get into this beautiful state-of-the-art campus here at ACI Medical and Dental School, I wanted to talk about the mission here. What does ACI Medical and Dental School do?
We specialize in 3 programs. We've been doing it for over 16 years.
Okay.
16 years ago, we found that there was a huge need for quality, short-term education in both medical and dental. And so we started, again, over 16 years ago to develop a medical assistant program with phlebotomy, EKG, and patient care, dental assistant with radiology licensing. And then we did a medical and dental administrative program, the operational part of both medical and dental.
Right.
And we work with the whole student. So we have students that come in for a very short period of time, 4 months full-time during the day. And then that next month, they're on internships and they're being employed in their new profession.
Wow.
In the evening, it's 9 months. Mm-hmm. It's on Monday night virtually, and Tuesday and Thursday on campus. Mm-hmm. So it takes a little longer because it's only 12 hours a week that we're able to put in towards their education.
Right.
But at the end of the day, they're trained with all the attributes, both clinical and didactical skills, to be professionally equipped in the medical and dental field.
Right, so it covers a ton of ground, this place, for people who are looking to get into these fields. What kind of accreditation does ACI Medical and Dental have?
We're accredited by Middle States colleges and schools. It's one of the oldest accrediting agency in the country. Mm-hmm. And just before COVID, we were recognized for a program of distinction in counseling. It's never been done in the post-secondary field before, and that's because we work with the whole student. Just like K-12 schools, they work with the students if there's a deficiency or there's a issue. The post-secondary level is just as important. Mm-hmm. to fill in any gaps or holes that they need to be able to get them focused and prepared to continue their learning. As a result, we have a 93% graduation rate.
Yeah, I was going to ask you about that. And I do remember you ACI winning that award. NJBIA covered that event. That was great.
Yes.
And you had some dignitaries here, which was really nice too. So we're talking about an accelerated program to either start or change a career. You mentioned the graduation. What's the pass rate?
Well, the pass rate is, again, a graduation rate is 92%. The pass rate on national credentials is 96%.
Wow.
Our national accredited credentials. Our medical assistant program takes 4 national credentials: phlebotomy, EKG, patient care, and certified medical assistant. Our medical and dental administrative program, the operational program, takes 3 national credentials: mm-hmm. the administrative credential, electronic health records, and billing and coding.
Right.
And then our dental assistant receives dental assistant national boards that they take and pass that they use for their radiology licensing. And this all takes place within 4 months during the day and 9 months in the evening.
Yeah, it's amazing. And what kind of students you get in here? Are there people who don't know what they're going to do for a career, or is it people looking for a change in career? What's most of your student?
That's a great question, Bob. We have all types. We have right out of high school, which is really a great way to start your post-secondary career. Mm-hmm. A lot of our students go on from the high school program, come and get their credentials, and then they go on for additional training with additional licensing or credentials.
Right.
And then, so we have empty nesters. Children are going on to college, and now it gives the parents an opportunity to go back and get a career or retool themselves for a career. You recently divorced people, or people just want to get a new career. So what's nice about the learning environment, that you have the younger students and the more mature students.
Right.
And in the classroom, the mixture and the combination and building off each other really allows to optimize the learning environment and to complement each other within the classroom.
Right. You get medical folks, military folks come in as well?
Oh, we do.
Yeah.
Yes, we do. We're veterans approved, and we just had one recently who was starting at our next start, and unfortunately, her husband was deployed.
Okay.
So she's moving and is putting that on hold until she gets back into town.
Right.
With her husband.
And ACI is really renowned for a great placement rate too, right? Getting folks right from the school into jobs.
Yes. Our recent rate that we have documented, and they do it every 2 years. You have to wait 2 years after somebody graduates, basically, before you show the results of that year for employment. Because if you graduated last month, they allow you 6 months to show the employment rate. Right now, year to date, January to date, right now, we probably have a 98% employment rate because of the openings that we have that are substantial in the medical and dental field.
It's amazing to me that like you could basically have a medical career, medical-based career. You know, sometimes people think, oh, I got to go into college for 20 years. I have to go into school for 20 years for that.
Correct. And right now, because of what we do and how we do it, we're able to do it again. 4 months, they start their internship. And because of the demand for our graduates, they're hiring our graduates, putting them on a paid internship to secure them so they don't lose them.
Right.
And then after a short period of time, they're actually hiring them and putting them on the books full time.
Wow.
So the transition from academics, didactic to clinical to employment is a smooth process. It's really a great way to get into the medical and dental field.
And do you get lots of inquiries from these facilities looking for your students? Like, who do you got?
Oh, you know, because we're accredited by Middle States Colleges and Schools, we have an advisory board.
Right.
And who sits on our advisory board is Hackensack Meridian, Center State, Monmouth Cardiology, Internal Medicine in Red Bank, Allied Dental, the VNA, local VNA with 5 locations. They sit on our advisory board because they believe in our programs and our students. We work with that whole student. It's no longer important just to have strong didactic and clinical skills. It's patient experience is really important. So being able to have strong interpersonal skills, problem solving and multitasking skills are the attributes, in addition to the clinical skills that you learn, is the value added you bring to the practice.
Right.
It's that patient experience. And so we spend a lot of time on the career assistant soft skills that are critical for the success of the medical and dental field. So the student leaves here well-rounded and knowing the value that they bring to the practice.
Right.
Their skill set is important, but it's the experience of that patient. Who's coming in sick and or not at the top of their game, utilizing your interpersonal skills to manage those events and that patient is what the employers are looking for, and they recognize our students compared to other graduates or other students or other professionals in the field because of the time that we spend on those soft skills.
Right. So how many active positions are we talking about in New Jersey for the fields in which you facilitate talent?
I can't speak for the state of New Jersey. I can speak for Monmouth and Ocean County.
Okay.
We just had 2 new postings come in on our website from practices local. We have 250 positions right now, active positions that we can't fill. And they're coming in daily. And these are practices that we haven't even worked with or known about over the years in the past. Our name is out there and they're calling because they can't fill them fast enough and we can't graduate our graduates fast enough. So again, the medical and dental field, 4 and 9 months as a beginning point is a great opportunity if anybody has the aptitude. And my recommendation is just come in, check out the school. You're going to learn that much more about what we do. And if there's some synergy or connection, you move forward. If not, you know that much more about what's not a good fit, which brings you closer to finding out what is a good fit. So it's a win-win to come out and check out our school and meet with the staff.
All right, so let's talk about this beautiful facility here. We've been to the old one. This one is aesthetically much more pleasing to the eye. What was the reason for the move?
Growth. You know, we were so tight at the other school. The clinical labs that we have you need space to be able to lay it out and just be able to optimize the skill and the learning process. So the additional space, and it just fits in. This is a 113-year-old building.
Right.
It's the first public school building in the town of Eatontown.
Right.
And to be able to pick move in here just under a year ago and added some offices, and we're in the process of doing some other fine tuning, but it's just a building that meets what we do and it just fits us perfectly.
That's fantastic. How about in terms of the equipment? So you brought over a lot of the equipment from the old place, correct?
Yes. The programs didn't grow. It's just the space grew, and we're looking now to fill the classrooms and move forward with the extensive waiting list that we have for the medical and dental field.
How many students can this place, what's the capacity is what I'm basically asking?
Our capacity is 500 students a year.
Okay. And the equipment, you shouldn't dismiss the equipment. I've seen it. It looks like state-of-the-art stuff for people to actually learn in these fields.
Yeah, no, we keep all the equipment current. We actually keep some of the older equipment, like we have an EKG machine upstairs, and I can tell when the instructors don't let the new students know that machine is outdated and old, because some of the practices don't always have the most current equipment. So we want to make sure our students can navigate along the new equipment, of course, but also the older equipment that you're going to find sometimes in some of the practices out there.
Like
So
even images of your teeth, right? I mean, they could be not digital necessarily, correct?
Oh yes, so we have a digital X-ray machine, but just in real world, sometimes that could be out of practice or out of operation, not working properly. And so we teach our students how to develop film, so they not only know how to do digital X-rays, but also know how to develop film the old-fashioned way.
Yeah. What kind of feedback are you getting from students when they see this place, or even prospective students when they see it?
Well, again, it's an eye-catching building.
Yeah.
It's open, the floors, the history of the building, which we have a section outside that we try to keep the history. We had an open house recently, and we invited the community, and it was so cute. We had people, about a dozen members of the community that were here back in the day, and they had a semi-small reunion out in the lobby looking at some photos back in the day and stuff. So we want to keep the historical part of the building alive and going with the town of Eatontown.
Right. I want to ask you a few personal questions about this, Frank. This place does have a mission, and when you see so many students come in and out, and they're out into a career, and you've given them, a path. How does that make you feel?
Oh, I can speak for all our staff on that. I'm blessed to be able to have a career and a livelihood that can give back to so many people. We have people in our school that have a 4-year college degree, which is awesome, or a 2-year college degree. Some people have tried 4 years and 2 years and weren't successful. So we have a mixture of all types of students. But the ones who come with us with the 4-year or 2-year college degrees, they started something, they finished it, and they were successful at it, but they didn't have the knack for the degree. The degree didn't offer employment opportunities. And when you can then introduce a career in the medical and dental field and work for 4 and 9 months and then be working, it's life-changing. And the testimonials that we have on Google reviews or on the website are just consistent in what we have done for people in their lives. And that really is better than any paycheck. We need the paycheck, but it's nice to have that on top of what we do. And our staff really take a lot of pride and get a lot of satisfaction out of the results of what we do with our students.
Yeah, I'll read you one of your quotes. Is I believe in the cafeteria area, where you have a bunch of quotes from very thought-provoking people, including yourself. The secret of success is knowing where you are in life, asking good questions, and then doing the right thing. So I think, would you not agree that ACI Dental and Medical School kind of lends itself to that credo?
Yes, thank you, Bob. That fits perfectly. That is what our philosophy is, and that is one of the quotes that I have, we speak on a regular basis. And we also use another one when we work with our students. We comment on things that give us a teachable moment, that can give us to be able to point out the successes, but also areas that will enhance their success in the medical and dental field. So we like having our students on campus to be able to fine-tune those skill sets. At the end of the day, we speak on a regular basis saying, you only know what you know. And our job is to make sure not only didactic and clinically that you know more in those 3 programs, but those, again, goes back to those soft skills, how you communicate, what you say, when you say, and how you say it to the patient and your coworkers and the doctors that you work with. And a lot of time is spent on that. And that's what our stakeholders recognize, that our graduates have a good handle on that, and they look for that.
All right. Thank you to Frank Preston and his great team at ACI Medical and Dental School in Eatontown for having us. Please go check them out at aci.edu. And we'll be back right after these words.